I told him I used to have a memory loss also, but I went to special school to learn how to keep my memory up, but I forgot the name of the school. Okay, that's a joke he was going to say.
I always say there's two things happen to you when you get old. One is you lose your memory, and the other one...
Very good, Bill. Thank you very much. Good night. Good evening. Well, we have lots of people here tonight. I thank you so much for coming, and I really didn't know what I'm going to talk about tonight, because up to 5 minutes ago, I had no idea what directions I'm going to go. Since 4 o'clock, I go one direction. I said, no, that's not good enough. Go another direction. That's not good enough. Go another, and then I just said, well, I'm just going to pray and say whatever comes, that's all I'm going to say. Okay, so the reason I had back and forth in my mind, because there is so much knowledge I have on cancer prevention, and so much knowledge I have about cancer itself, and so much knowledge on nutrition itself, and which one to give to the people to go out with and have impact on society. So rather than spending the time teaching you how cancer develops, how does it kill, how does it do, which I usually do, and rather than saying mini jokes and laugh and all of that, I want to take it a little bit more serious and go specifically through Shaklee products that have impact against cancer, and take one at a time. Hopefully we can cover maybe about 4 or 5 of them tonight in the end of the lecture, in details I'm talking about. Then maybe next lecture couple more and so on, because I looked at my papers and I had written maybe about 60 pages on the benefit of Shaklee vitamins against disease, but I never talked about it to anybody. So when I was searching, I said, oh my gosh, this is something important people didn't know about. But again, because I don't lecture very much and the time is limited, the span of the mind of the people listening, they cannot comprehend very much. And nutrition is boring, I mean, who wanted to take time off basketball and this and come listen about health when you can go to the bar, and have good time. So it is the least thing people really think about is health. Fun, yes. Health, no. And until you think about it and you get hit somehow by a, God forbid, stroke or a heart attack or this or that or a friend, then you start panicking and thinking about yourself. That's include myself, by the way. I have to rethink myself. Am I doing to myself what I do to my patient or not? I have to reevaluate every once in a while, because sometimes you get so busy taking care of everybody, forget about yourself. And that's sad, because if you don't take care of number one is you cannot take care of number two is everybody else. If you're not good for number one, you're not good for number two, right? And that is what this lecture is all about. The lecture on cancer and the lecture on autoimmune disease is coming. They are connected lectures. They are continuous lectures. They're related to each other. Okay, you understand? So this picture I put right there is really put it there just to confuse you a little bit, to try to make you figure what is going on there. This is actually a very highly scientific paper, was published by Harvard Medical School 1997. You don't have it in front of you. I put it there for the people who have doubts about nutrition. All of you by now, nutrition under very serious, severe attack in the media. Beta-carotene was attacked 10 years ago severely. Vitamin A was attacked severely 4 years ago. Remember that, or you forgot. If you forgot, take Acuity. And you know that soy protein was attacked 2 years ago severely. Right or wrong? And all of you remember that. It seems like everything we try to do good is bad. There's nothing we can do good. But if I stand right here and talk about Ritalin, about drugs, about alcohol, about vodka, about anything, then not everybody's happy about that. But you're talking about nutrition to the public, it seems like they look at you and says who you are. What's your qualification? What kind of proof you have? Just like telling people, I want you to believe in God. I said, what proof do you have? Why should I listen to you? You know what I mean? There are certain things you cannot convince people. And when you talk to people who are negative, please get rid of them. Because negative people, they drain your soul out of you. When you talk to somebody, try to convince them about something good for them or something, and they argue, actually they're draining you out. You just make it simple. Your kids or husbands, spouses, fine, anybody doesn't want to believe, that's fine. This is their business. I do that to my kids, my grandkids. I said, you're eating cereal, you're going to die, you're going to have cancer, goodbye, and then I go to my room. I come back, 1 hour later, they're eating apples and peanut butter, and I made an impact. Or I come back an hour later, it doesn't matter. Coca-Cola is there, and Pepsi, it doesn't matter. Then I repeat it again once in a while, because my grandkids. But if this were my friends, then I will just say it once, and that's it. You follow me? Because your family, sort of, you got to take care of them a little bit more. So this article here was published to prove, I'm going to make it simple to you, but I just want to show it to show the people here who have doubts about nutrition. Oh, by the way, nowadays antioxidants is under attack, by the way, this year. Now vitamin E is poison, vitamin C is poison, beta-carotene is poison, and all antioxidants, not only no good, is bad for you. And this is being published in New York Times, in all of that, and people listen to that. And they say, yeah, I'm not going to take this anymore because I heard it's bad for me. Have any of you heard the article said vitamin E is bad for you? How could it be? You mean olive oil is going to kill us? And then how many of you heard beta-carotene can cause problems 10 years ago? Raise your hand if you heard of that before. How many people think carrots are going to kill us? And so on and so on. And whenever you want to do good in life, believe me, you're going to become minority, and you can become the enemy of the devil, or enemy of society. And you got to be strong and have faith and have a message and don't deviate from it. It doesn't matter if 100 people say no to you and one said yes, you're still winning. Are you following me or no? So today I just put that here just to show people who have doubts here that this was published by Harvard Medical School. But basically what the article here says, that's not part of the lecture, but just happened to see it, it was they put so much poison in the blood of one person, so many chemicals that cause cancer, and they gave him vitamin C. And the vitamin C amount went like this. Why did the vitamin C amount went down when you have more poison? The more poison, the less vitamin C in the blood. What does the vitamin C do now?
Capturing the free radicals.
Anti-free radicals. So this is the proof right here. This is the proof right here, right there, the article. But still, the people who have no faith in nutrition, they still bombarding, and then when you tell them, prove it, the doctor or something, give me an article. I said, I don't have any articles. I'm just telling you so. So I get so many patients telling me, I cannot take soy protein anymore because doctor says it's going to cause cancer of the breast. I said, well, he's wrong, I'm right, it's up to you. I was honored to come across. I was looking for a doctor to work for me, to help me in the clinic. So I had lots of resumes, And they're not cheap. You know, you pay any doctor who comes for work, you have to pay him $800 per day. You know, every day for 6 hours, $800 if you want a doctor. So I got lots of, I just need a doctor to cover me once in a while, once a week, or whenever I need to. And then I look at resume, and then all qualified. But one of them is the same age like me. I said, that's the one I'm going to select. I didn't even look at his recommendation. And I selected that one just because he's older. When he came to see me for interview, he turned out to be 23 years professor of surgery in medical school. And he is retired, but he want to come back. So I said to him, I told him, I just want to tell you what I do, so maybe you don't like what I'm doing. You are from Korea, and Oriental people have open mind and nutrition and things like that more than Americans do. So I want you to know that I am in nutrition. I hope you feel that way, because that is my field. And he agrees. He said, I know nothing about it, but I believe in it. And said, by the way, you've been 23 years in cancer research. What do you think about that article that says soya protein can cause cancer of the breast? I'm just testing him, right? He said, that's absolutely wrong. Who said that? So he never heard about it, but he agreed. We use soya protein to treat cancer, he said, in Korea, South Korea. So he agrees because he's a professor in open mind. So he joined me right now, and he works in the office once in a while to help me out with patients and things like that. Some of you might have seen his name, Dr. Kim. So what I'm going to do right now is figure out what I'm going to do. Okay, yeah, here it is. Well, I don't think I can read that. That's so pale. Okay, well, anyway, it doesn't matter. Office Max did a poor job, so you can blame him for it. Basically, I cannot even read it from here. Basically, this is a summary. It says there is 4 million people. You're going to see me carry this a lot tonight because I want to give you solid data, during the election. 4 million Americans have cancer, active cancer right now, known cancer. And 1.5 million every year new cancer cases. And 1 million die from cancer every year. These are statistics that is very serious. So if you feel sad that some crazy person killed 20 people here or 30 people here, you feel sad, you should really be very depressed, knowing there is 1 million die from cancer that we could prevent. Are you following me or not? But people are emotional. They get excited about something and they get sensitized about something else. Just like you hear in the news, 60 people in the world killed in this bomb or this blast or this here or that. We became so sensitized that we be drinking coffee and say, pass the toast, where actually the news going on that 50 more people got killed. There's no feeling anymore. And the young kids have that now. They go in video games and things like that, shooting human beings. And then they're proud of it. Not only they have poor health, their habits and is deteriorating. And if you make a movie like Rambo and then you're killing people, it becomes a bestseller. But if you make a movie that you're shooting cats, everybody be demonstrating in the street. See the human quality we got to? Us, we're not important to each other. To an ant or a bird or an animal, they're more important. And that is very, very dangerous and sad. Because we are human by God and we have to be loving each other more than anything in the world. But unfortunately, that's going down. We're going to just put this aside right here and talk about what is the cause, what kind of cancer do we see? We see lots of cancers. You start from the skin. There are some cancer you can see, like the skin. Melanoma of the skin, the dark spots, they are dangerous to have and you should have them checked. Breast cancer is obvious, you can feel them. Prostate cancer, the doctor can feel it. Other cancers are hidden. Lung cancer, colon cancer, pancreatic cancer, liver cancer, kidney cancer, colon cancer, you don't know. It's silent, silent, silent until suddenly it shows. And that's your fault and the doctor's fault. Because we both have to assume the worst and hope for the best. But never assume the best and wait for the worst. Because if you assume the best is going to happen and wait for the worst, you're going to be a loser in everything in life. You're going to have to, when you drive a car, you're going to check the oil. And you're assuming you're going to have low oil, right? Or wrong? But if you assume everything is fine in the car and drive to Los Angeles and burn the engine, that's your problem. And that's what we do with the human body. We walk in bombs. As long as we look good, we think we are fine. But we're not. As a doctor for 30-something years, we are sick from inside out. And we have to detect cancer. Cancer cells can be any place. Cancer cells, they are regular cells. And a regular cell looks like this. It has a membrane. It has hands around it like this to grab food. It's called receptors. The hands, they grab vitamins, they grab nutrients, and take them inside the cell. Are you following me or no? Yes. Okay. And the membrane here is made from omega-3 that it has the guys sitting here that have the hands. So those hands attach to these guys right here called omega-3. Then they take the food, they put it inside the cell, the nutrients I'm talking about, and then it gets carried in by a guy right here with like a messenger. He carries it and take it to the mitochondria, that's a laboratory where it gets processed and produces energy, and we live longer and so on. This is the normal cycle of life. This cycle of life is controlled by something in the middle called the DNA. The DNA, everybody heard about DNA. Anybody have not heard about DNA? Raise your hand, I'll tell you what's DNA. You didn't, everybody knows. Okay, DNA is the protein that you inherited from your parents that make you healthy or sick, control your life. And those proteins are hanging on hair-like things called what? Chromosomes. So the genes called the protein, DNA, are hanging on the chromosomes. And how many proteins do we have, human beings have, inside the nucleus? How many types of protein? Total, 4. 4 proteins make the codes of life. All the codes of life in the human body made by 4 proteins. Imagine that. If you are genius in computer and I give you 4 probabilities and tell you out of 4 proteins, I want you to produce 20 trillion reactions per second, you cannot do it. And your computer can, but the DNA can do it. So the DNA is so sophisticated that it is protected by another membrane around it, made also of omega-3, to protect it against, let me use another color, radiation that can go through the cell. You follow me? If radiation go through and hit the DNA, what will happen? Mutation or a chemical. So the Lord, what he did, he said he made 2 layers of omega-3 there, and then they haven't attacked omega-3 yet. But by next year, the fish will be attacked. So be prepared for that. So the omega-3 here protecting the DNA. So what happens if the person have a deficiency of the omega-3? The DNA can get what? Can get sick, can get mutated. Look, let's give it a different color. If it has a different color, mutated, I'm talking mutation, you think the cell is normal or not normal? It's not normal. And that's it, because not normal, it doesn't listen to the brain, it doesn't listen to the lymphatic system, it doesn't listen to the killer cells, it doesn't listen to anybody. So what it does, like a baby, what it does, it multiplies, right? It can multiply, but once it multiplies from 1 to 2 to 4, it does something the baby does. What happened to the baby when the baby formed 1 cell, 2 cells, 4 cells, 8 cells, 16 cells? What the baby do? Looking for what? Food. What does he do to get food? Attach himself to the placenta of the mother, right? To suck what? Blood. The cancer cell does the same thing, knows the trick exactly. She will secrete messages to the area around it. I'm just an innocent good cell, I need blood. And the body give it lots of blood. And the cells multiply. So when cancer cell is an individual cell, can we detect it by a CAT scan? Just 1 cell. Can we detect it with an MRI scan? No. We can't detect it at all. If it is 4 cells, we can't. We only can detect it when it reaches 1 million cells. That's like a 1/10 of an inch by 1/10 of an inch. And that sometimes is too late, sometimes is not. But that's 1 million cells. Follow me? That's 1 million enemy. Follow me? They're gonna each one to fight for survival. And they send babies all over the body to look for food, colonizing the body. And each one does the same thing. In the meantime, we have a way. I show you this article, paper right here. You probably have a copy of it. If you don't and you came late, it's just too bad. Then you're going to have to make a copy of somebody else. We have something called protein in the blood called tumor markers. Blood tests, we can predict up to 5 or 6 cells. We can predict that there is 5 cells of cancer with that. But we cannot do every organ. As you can see, some of you have it. We only can do breast, colon, rectal, liver, ovary, uterus, prostate, testicles, and brain. That's the only thing. We cannot do everything yet. But the research is going on right now to advance that issue right now, and you probably read in the back of it. And if you show it to your doctor, 100% he's going to tell you, no, I'm not going to do it. Because when I was in medical school, graduating with honor from internal medicine, I was asked a question by my professor. How are you going to practice medicine in my oral exam to pass, to get my license? I said, what do you mean by that? He said, well, when you do cancer markers. That's what I'm talking about. I said, do you want me to give you the answer you like to hear, or the answer I'm going to do? And he was my friend, my professor, and my friend. He said, no, I want you to give me the answers you're going to pass the test with. Then I told him, we'll wait until they have cancer, we'll check them later. He said, but that's not what you're going to do, that's fine with me. You see what I mean? Because if you go to a doctor and said, I want you to do this, it will say, why should I? If I do it and I don't know what it is, you might sue me. Or there is no proof really it's accurate. You mean no proof? You take one right here. I gave you the article about which one I gave you? I think I gave you the article about the woman who had the breast cancer. I just want you to read that to feel that she, there is another one, she requested her doctor to do a tumor marker, CA125. And he said no. And she's telling him, like you're telling the doctor, it's only $150 test, doctor, do it. No, you don't need it. And he thinks he's God, you don't need it. Then when she developed cancer, he did it. And it was too late, she died. Okay, that test, in the first page, it says CA125. It's a cancer if you need a copy of that, you can call my office. We can send it to you for free, by the way. Cancer antigen, CA125, a tumor-associated glycoprotein is elevated in 75% of ovarian cancer. This was 1972 when this was published. It's elevated in 99.9% of ovarian cancer now. So if something's 99.9% accurate, don't you think we can do it for $150? Sure. You see, we spend more than gas. But right now, the whole issue is ignorance, and you must educate your public. I'm going to give you the tools tonight through the Shaklee Nutrition, what to say, what to do, because it's going to be on the DVD. So this is how cancer cells behave. Let me put the stuff away right here because it's going to get me more confused. Okay. Now, the body protects itself. Here is the cell again. That's a cancer cell now. The body protects itself against cancer cells for several ways. Number one way is in the blood itself. In the blood. Let us go inside the blood and draw a picture of a person like this. This is you, and this is a cancer cell is developing, let's say, right here in the ovary. Once that cancer cell develop in the ovary, around it, this is a cancer cell right here we're talking about, around it there's blood. Those blood cells are circulating through the whole body in your system, they're not fooling around. For every drop of blood, there is 7,000 soldiers looking for cancer. For every drop of blood, there is 7 of them awake all the time. And there are 30,000 stuck to the wall ready to fight, but they're not active. Are you following the point now I'm talking about? In the arterial wall or the venous wall, there are 30,000 ready to go. But the active duty is how many? 7,000. And the 7,000, they are so neat. I have the picture with me here. If we have time, I show the picture fighting, actually, and doing the exact killing. I have the real picture with me here, but let us see if we have time in the end to do that. They come like this. Let's assume this is the white blood cell right here. The white blood cell have tools to detect cancer cells. First, they have the sight. They look around. They have a binocular in their hand like this, and they look, and they see what the cells around them look like. They're scanning. And if anything doesn't look right, they may remember that. How do they do that? It's called by the code, the genetic code. Every cell have a social security number. And my number comes out of my cell is so on. And the same number is in my white blood cell. The cancer cell lost their number, don't have the same number. So once they detect a cell without a number, they take it in memory. That's not belong to what? To us. You follow me how they work? Then they have a little telephone or fax machine right here, and they will call the lymph nodes around the area. Are you following me or falling to sleep? Okay. They call the lymph nodes around the area here. Around the area. Here is a cancer in this area here. They call the lymph node around this area to tell them, we find something here, be ready to fight. So the fight is not the whole body, the fight is local. You get the point? The same thing with the brain in any place. It's local first. And they tell them, we just saw something looks weird. And then they do something else. They will extend their hands like this. One hand like that, and they will feel around it. They go like this. They feel it. And we have a picture of that also. They will feel with the long hand like this around it. And they checking for a weak spots, holes. And when you magnify the cancer cell big, real big, every cell, not cancer cell, every big, really big, you find there is 4 holes. One look like this, one looks like this, one looks like this, and one have a different shape, looks different shape. 4 different holes. And they tell them the sequence of the holes, how they are in the wall. So later on, if the cancer cells succeeded of spreading here, those cells right here are ready for that. And I tell you how. This cell already reported the whole picture, right? Then it will say, now I'm going to go for the kill. They call them the killer cells. That's why we call the natural killer cells. In case we check the blood of people, we see how many killer cells you have active. If you don't have enough killer cell, we said you are in trouble. So we give the people vitamins, immune globulins, nutrifuron, all kind of thing to build their immune system that way. So they will put another arm around, they come close and they eat it. And we have another picture. They ate it alive and spit it out in pieces. Also, we have picture like that. So this is how the body fight. Let us assume the cancer is very strong and the person is weak in that spot. That's a defense area number 1. Defense area number 2 right here, which called what? The lymphatic system. I just told you a few minutes ago. Then here comes the cancer cell coming like that and walking through the trap. Every blood, all the blood has to go through the lymphatic system. Nobody's going to escape the lymphatic system. Everything has to go through that gate. And in that gate, you will have soldiers waiting right here. And they have made little nails in the same configuration of the hole exactly, same size. And they will bang a piece of protein in each hole. So this hole will be filled, this hole will be filled, and this will be filled, this will be filled, and this, they bang it in. Not only they bang it in, they even destroy, damage it, they bang on it. They attach 60 of them over it until the cell itself cannot even walk, and they blew up. And then they ate it. See the second line of defense. Delicious, you're right. Okay, then the cancer cell might not be there, but the cause of the cancer might be there. What are the causes of the cancer? The cause of the cancer can be 4 different things. Genetic, that your parents gave you the wrong immune system, or nutrition, that you ate in the wrong protein. You're supposed to eat soy protein, you eating junk protein, you're getting hormones, you're eating bread, you're supposed to have whole bread, you're eating sugar, or you're supposed to have olive oil, you're eating junk oil or fat, you're not taking vitamins, you're not taking mineral, you're drinking the wrong water, you're not taking enough fibers, whatever, you have a problem here. That's another problem. That is, it could lead to cancer. Third is stress. A weakened immune system. It can cause cancer. Fourth is worship. People who do not worship God, they have more cancer, and they have than the people who worship. People have faith. They study that in Mayo Clinic. They study that in Mayo Clinic and they were so unbiased because they don't want to have any religious issues at all. They had people in different faiths, and they didn't ask them what your religion is, what your faith. Do you have faith in God or not? Everyone, do you have faith or not? Some people have faith in rocks. Some people have faith in God. Some people have faith in this. And others had no faith at all. The one has some faith, they all have 30% more immune system, and the other have 30% less. So what's the point here? The point here, when you have a faith, you're positive. So you have confidence built in. When you fail, somebody else will succeed. Are you following me or not? But when you are alone and you took it in your own hand, you say, I am in control. Nobody can do that. I can create. I can destroy. Nobody can help me. You are a loser. You follow me or not? And the research has been done on that. So worship is good. Sleep also. People who do not get enough sleep have poor immune system. Exercise. People who do not exercise have poor immune system. So these are the causes of cancer right here. Then the last cause, which is the most common, chemicals. Toxicity. Toxicity in the water, in food, and air and everything. We don't need to talk about that. You believe, right, we have toxicity, correct? So if you have all of that, you have a problem. So the third line of defense, which I just lost the first and the second anyway, then we just assume we are in the third one right here. The third line of defense, the antioxidant, the anti-free radical that's been under attack right now. They got their name from anti-free radical. What does the word free radical mean? Okay, let me put the question a different way. What's the word radical mean? Different. Radical is not a bad word. It can be a good word. Radical means you are different than other people. In chemistry, the word free radical is a bad word. Means an atom that lost respect to the society and the body and the air and go and freely attack it, everything it sees. It's free. Because in chemistry, everything has to be in pairs. Like that, not free. Nothing is free. They all attach. If you have iron, ferrous, sulfate. Ferrous, gluconate. Copper, sulfate. Psyllium, this. Zinc, this. There is no single one by itself God made. Everything is attached to each other. So they're not free radical. The free radical is an atom. It's an atom that, like oxygen, how many atoms it has in it? 2. O2 we call it. This one has O3. It has extra what? Extra oxygen atom. By having an extra atom free, let me give you an example. Hydrogen peroxide. H2O2. Okay? We have H2O. What's that? But this has extra what? Oxygen. Extra oxygen means it's free radical. So if I put hydrogen peroxide on a germ, what it does to it? It kills it. Because it's a free radical. But it's a good free radical. We use it to kill germ. But if you drink hydrogen peroxide, or some people right now, giving hydrogen peroxide intravenous to people to detoxify them around the world, there are doctors who are giving hydrogen peroxide intravenous right now. And they ruin it for us in good nutrition. Because the FDA look at the good and bad as equal. Are you following me or no? And those are dangerous. They do that in Mexico. They do every place. Like people do Clonix, coffee enemas. Coffee is a free radical. It's okay to have a cup of coffee once in a while, but not to drink it that way in any way, by enema. And also that much, you follow me? And the people do it. So be sure that you really don't need to go out of control in your mind to be healthy. You are eat what we say today, regular good food, take your vitamins, do your exercise, control your chemicals, and you're going to be fine. And get a checkup. You don't need to go wacky and look at catalogs and get this and weird stuff and all this stuff. But you don't need it. Shockley catalog have everything you need right there. We don't need any extra stuff. So, what does the extra oxygen do? Because it's free, it has to be attached to another one that's also free. So, they neutralize. But in the case of the DNA, which in the case of the DNA right here, it will attach itself where? To the DNA. Once it attaches to the DNA, it causes what? Cancer. Mutation. It's cancer. So the third line of defense are called antioxidants. This is the third line of defense. Fourth line of defense is a very good one. That's the one coming right here. This membrane here has what? Omega-3. Omega-3 has what? Many hands. If you fill those hands with soy protein, there is no place for the free radical to attach itself to the cell. And that's the reason we say soy protein is good, because it has flavonoids that it does that. The fourth line of defense is inside the cell, the beta-carotene and all the other stuff, and the immune globulins and the defense of the body inside. And then we leave that subject to go talk about something important. Maybe I just refresh you a little bit right here by showing you pictures, real-life pictures of the attacks going on. You remember I told you the cell will send a hand to find something. Right now the cell is sending a hand and she finds a germ or a cancer cell right there. And then it came closer and ate it and destroyed it. You see that or no? Okay, that's real picture. I hope I find a bigger one. I just don't want to waste too much time in these things. This is a regular cell with cancer cells around it. It detects them and bringing them closer. Here it is. Here's the picture I was looking for. Okay, this is the cancer. This is the regular cell in the top right here, and send their hands all the way down to feel the cancer cell. Isn't it beautiful? This is real life pictures, not even artist picture. We are miracle walking in this earth. You know, you gotta appreciate that temple God gave you to protect and defend as much as you can. Don't ruin it with drugs. Don't ruin it with chemicals and taking the wrong stuff, and just protect it, because if you ruin it, you're the only loser in the end. Let me see if I have the stuff I'm going to be talking about in order or not. I have here some products I want to talk about. I'm just gonna put that here just for the video, for the DVD only. This is a scientific proof that the natural soya protein is actually protect you against cancer than cause cancer. In that aspect, the good estrogen, Emin's estrogen, good estrogen attach itself from soya protein to the cell, preventing the bad estrogen from coming to cause cancer. Okay, and we're going to show you a little bit more chemistry and details than that. This right here is the chemistry of that. that estrogen, there are two kinds of estrogen. There is the E1 estrogen and E2 estrogen and E3 estrogen, and then we basically divide in the estrogen to the 16 OH and 4OH, and like the synthetic estrogen, natural estrogen, and the synthetic estrogen is not at all similar to natural estrogen. As a matter of fact, I gave you an article right here from Chicago Tribune, you've probably seen it, that progesterone, it fights what? You've seen it if you read it before the lecture, cancer. So hormones are anti-cancer, but now we have generations of people believe that hormones causes cancer. And hormones is what keep you young. That is, so don't, natural hormones of course. I wanted to remind you, but in the lecture we gave our soy protein, and in that one I just have to find it, see what it is first so I can see it. When you get older you have to use glasses, and that's what I'm doing right now. And if you can find it, then you have a problem. No, I did find it. Okay. I put right here in front of you 11 different type of reasons why soy protein fights cancer. It is a flavonoid. It has isoflavone, ginseng, diazinon, the three chemical got put in the soy protein. What does it do? I'm just going to go through it fast because we don't have lots of time. Inhibits protein kinase. That's the enzyme that cancer cell uses to spread web. Inhibits means what? Stops it. It decreases cancer adhesions. What word adhesion mean? When cancer want to become a colony, it dissolves them. Number 3 is anti-angiogenesis. Angiogenesis making new blood vessels. The cancer cells is notorious for that. They secrete so many messages, they need blood. So that whenever we see cancer, it's always bloody. Once we open the area, it just bleeds all over the place because the cancer sits around itself with blood. So the soy protein allows you to have good circulation, but with cancer cells, it blocks the blood from going to it. It also fills the hands, called estrogen receptors. It also increases the apoptosis. The apoptosis is a medical terminology, means the ability to eat something. So the appetite for white blood cell to eat more and kill more is called apoptosis, increases the killing effect. It helps chemotherapy to work better. So imagine that, tell your friends who are on chemo. It does protect the prostate from cancer. When you take the soy protein with vitamin C, it decreases cancer growth together. When you take the vitamin, when you take the soy protein with beta carotene and vitamin D and calcium, increases the angiogenesis also. And then actually they added, this is number 11 right here, they added soy protein to cancer cells, to the cancer area. They find the white blood cells, they multiplied faster and they ate faster, the cancer cell, than without the soy protein. You follow me? So at least that part we got rid of that myth so you don't walk out of here ignorant. Okay, the other topics I'm going to be talking about is really not related directly to cancer, but indirectly they are very important. I'm going to tell you a little bit about a product called osteokinetic, or we call it now, it has, what's the name of it now? Joint Health. Joint Health has glucosamine, right? Glucosamine increases the hyaluronic acid. That is the substance the white blood cells uses to extend and kill with. It has alfalfa in it, and it also it inhibits the prostaglandin that cancer cell uses to cause inflammation. The mechanism of action of osteokinetic, it does good things in the body, from calming nerves to reducing arthritis, diuretic, stimulates appetite, it makes cancer patient eat more, but it has a substance called cististerol, and cististerol is a flavonoid that it does two things. It inhibits cholesterol, inhibits cancer growth. Two things in the same time, especially in the breast and the prostate. That's one product I want to get out of the way, because we're not going to be talking about that in the future. Okay, this is the stuff I told you earlier, that I want to give you in the end of each lecture few products to get to know the scientific background of it. Even chocolate scientists themselves might not know that. We're going to talk about another one called peppermint ginger. You heard about that, right? You'd hear that, and we just ignore it. Let me tell you what's in it. It has 3 products in it. It has ginger, it has fennel, it has anise. Let's talk about each one. Ginger, it has a flavonoid. It's called zingopain, which is anti-inflammation. It's a prostaglandin inhibitor. Oh, I think maybe I have it here and I can put it, and you don't have to look like you are lost. Let me find it. The guy who did the copies for me did a great job of mixing them up. But that's okay, we forgive him, he tried. He tried to do it, he did a good job. Yeah, he did a good job of mixing, but I found it, thank God. Okay, this at least, it's right there. The other one, I forgot to put on the screen, just forget about it then. Okay, so the peppermint ginger, the simple product, look what's in it. All the stuff in it, in front of you. So we're going to go in details and product that we ignore in normal daily life. The ginger, it has zingopain, which is anti-inflammatory. It has papain enzyme that helps with digest enzyme with EasyGest. It's a PG2 inhibitor, prostaglandin inhibitor, which inhibits the cancer growth. It has gingerol alkaloid, which is another cancer inhibitor. It's antivirus. It's a natural Dramamine, so it can be used for vomiting and all of the stuff. If you mix with honey and lemon juice, it's great for sore throats and some vinegar. It has also another alkaloid. It's anti-migraine headache. So it can be used for migraine and also headache. So now we're taking a product that was only for the stomach, and now we're making it for lots of things. So you become like your own holistic doctor, your own holistic clinic at home, and when you have this documentation, this has all been scientifically proven.
Peppermint ginger is now a stomach soothing complex.
A stomach soothing complex now, okay? So it's a stomach soothing complex. This is written before they changed the name, okay? So well, I'm ancient Egyptian, so what can you expect? I still live in King Tut era. So anyway, that's okay, but just change one for another one in your mind. Okay, and anyway, both of them do the same thing. It has fennel, which is a muscle relaxant against cramps. It is finchin, which is like alkaloid. It helps against PMS. It's also anti-attention deficit disorder. It is a decongestant. It increases sex drive in women. Now every woman going to be taking it. Increases appetite, increases digestive system, decreases nausea, decreases gas, all the stuff right here in digestion, bad breath, and all the stuff. And then we go to the last one in the little product called stomach soothing complex that we ignore. Look what else it has. It has anise in it, it has the chemical compound in anise called anthithol, which is actually antispasmodic for the intestine. It has actually 1, 2, 3, 4. It's about 6 alkaloids in it. You can see them in the end if you know how to read biochemistry. But it is good for digestion, decreases cough, and also those are symptoms associated with cancer patients sometimes who are in chemotherapy. So you can use this product to help these people without interfering with chemotherapy. You follow me or no? Okay, the next one, let me remember to put it here and see how good he did a job. He did a good job to put it. It's the sopalmetyl in this page and the valerian. We're going to go over that. And it is 8 o'clock. We're going to be finishing with that page, and we take some questions because I am not going to be standing longer than I have to. I guess you know why. Okay. Sopalmetyl. You know, when you think about sopalmetyl, you think about what? Men, prostate. Let's talk about it for a minute. Sopalmetyl, it has 2 products in it. It has sopalmetyl extract. It has also beta-cistrol. So it has 2 products. Let's go through each one. Sopalmetyl. It's a steroid, natural steroid. It's a flavonoid. It's a fatty acid. It decreases size of the prostate. It decreases swelling of the prostate. It relaxes the ureter. So far we're talking about men. Now we're talking about women. It helps the bladder against incontinence. So women can take sopalmetyl without thinking they're going to be men. I know you want to copy us in everything we do, but you can copy us in that one too. No, I'm just kidding. At least you're laughing, at least, you know. So anyway, it works actually for prostate for men, work faster than Proscar. It has an enzyme that inhibits the DHT that causes hair loss. So that stuff you read in TV, you know, it's in the sopalmetyl. You grow more hair. But so if you lose it, you might get it back. But anyway, it inhibits prostate cancer. It also it does inhibit cholesterol, lowers cholesterol significantly. So it can be used against cholesterol. Remember, the same substance against cholesterol is the same substance against cancer. Beta-cistrol work in both ways. If you read about it in the internet, it's the same substance. So don't think because a product called sopalmetyl is just for men. When we talk about, when next time I have right here menopausal complex right here, gosh, there is so much on it right here that every man gonna be taking it. Yeah. Because the company has to put a label so they can sell it that way. You follow me? If we say sopalmetyl, I'm gonna take it. If we're in a menopausal, I'm gonna buy it. But my job is to tell you the real truth about things that have a lot more benefit than you ever think. And if you take it, it's not gonna hurt you. It's not like testosterone or something, hormone, you're gonna grow beard or anything like. No, this is all natural product. Our ancestors ate both of them together. You know, our ancestors thousands of years ago did not go through the gardens and figure out which one for men, which one for women. They were both eating the same stuff, right or wrong? So I wanted you to understand that. The last one I'm going to talk about is valerian. That's a gentle sleep. Okay. I saved you a trip. Okay, somebody, she told me right here. Okay, well, thank you so much. This has 3 things in it. It has the valerian in it, which is from passion flower. It has the chamomile flower in it. Let us see what valerian does. And this is, I didn't change it. Okay, let us see if he did a good job on that one too. No, he did not.
It was on that one.
I was on that one? Thank you. You've been taking acuity. I'm going to double mine then. Or go to that school. Okay. Valerian. The reason I put the stuff on here, it might sound really funny and we joke and all that, but actually there's a message inside here. I have scientific names here. I have biochemistry products in here, if you read it carefully. So scientists who disagree, all they have to do is educate themselves before they talk. Because there's nothing worse than half-ignorant person that he say without knowing. You know, and many of them do that against nutrition. So we have to attack back. And you know we have to attack back. I just came from Washington about 8 weeks ago. I think maybe 8 weeks ago. I think it was March 27 when I had dinner. I was honored as Physician of the Year again. 2006, I went to abdominal brain abortions, all that stuff, and all this garbage. And then here we are sitting, and I want to present the agenda of nutrition. I'm not there just to make friends. I didn't go to make friends. I don't need friends. The only 2 friends I have is God and my friend. And there are neither of them over there in Washington. You know? So I tell them that when the Congress said to me, my friend, I said, no, I'm not your friend. God and my friend, and you're not one of them. But you are representative, so listen to me first. So don't give me drink and have coffee, have alcohol, and let's be serious. We were physicians, lots of physicians, we were solid together and our attack for nutrition. Every single physician there, we work against the policy that the Congress passed against vitamins, and the Senate, they expected to pass it, and we're going to fight it very hard as physicians. The American Nutraceutical Association, American Holistic Association, we have about 1,000 physicians right now against it, and we are gathering the numbers to do that. But in any case, we want more scientific proof to convince these people that we're not quacks. So it has, the valerian has contain valoprotein, which is a muscle relaxant. It has tannins, it has alkaloids. This is all the scientific stuff. Let us see what it does. It's a sedative. It calms you down. It by making your brain make an enzyme called GABA, gamma amino butyric acid. That's a transmitter that make you calm and go to sleep. It's called GABA. And make you have that. You follow me? It doesn't work by narcotic or anything like that. That's how it calms you down. You can use it in the daytime, you can use it at nighttime, you can use it when driving, you can use it anytime. It's a very good product. It also works as a muscle relaxant for intestinal cramps, diarrhea, muscle pain, muscle cramps. Valerian also good for that. Because it's work for the autonomic nervous system, also the sympathetic nervous system. It helps irritable bowel syndrome very well. It helps against endometriosis. It helps against Crohn's disease, insomnia. It's anti-stress, and it is a very good for ADHD. Especially in Germany, they use it now for ADHD. It's been approved over there for that. This is just one part of the valerian. The other part, which comes from the chamomile, which is the passion flower they added, the ingredient in it's called apigidine, which is a flavonoid. It's anti-anxiety. It reduces inflammation. It's good against arthritis. It speeds healing. It protects from ultraviolet damage to the skin when you are by the swimming pool. So imagine valerian, we're talking against something that we don't even know about. You follow me or not? This is all the scientific stuff being published, by the way. Protect against ultraviolet, it's a muscle relaxant, it's an anti-candida. So you don't have to go on all this Candida diet and all that. Here's Valoria. So when you go to somebody giving Valoria for sleep and then you have all of this, you need that kind of proof right here. Otherwise, they think you've been getting it from the National Enquirer, and this is not right. Well, I do thank you so much. I'm going to take some questions, and then we're going to do the same thing next time. And autoimmune disease, we're going to give a few products in the end, so you have like weapons to use for your product when you introduce it to public. You can reproduce anything I say tonight in papers and give it to people, but don't sell it to people. Okay, I'm going to give you my phone number. I'm going to take questions only for 15 minutes because, my leg is sore a little bit. So I'm going to give you my phone number. You can call me. It's 847-571-3914. That's my cellular number. I receive about 45 messages a day. So you read one of them. So if the voicemail is full, I go to the text and see who called, and try to call them back, but sometimes I don't. So you try again. And then my office is 847-356-9009. And I think if you have some of the article we passed right here tonight, I passed one on soy for you. You probably have it. I also gave you one on the tumor markers. I give you the one on the story of the lady who have problems. And I don't know what else. I give you another one on hormones also. Okay. So what question do we have? Yes, sir.
H2O2 is hydrogen peroxide, right?
What's that?
H2O2.
H2O2, yes.
It's hydrogen peroxide.
Hydrogen peroxide, yes.
And it has a free radical in it.
I'm sorry?
It has a free
It is a free radical, yes.
And it also is very corrosive.
Very corrosive, yes.
And it's also basic, right?
Yes, it is.
Acid is basic. So what is this big talk that people always talk about keep your body alkaline?
It's baloney.
Okay.
There is no way you're going to be the way God made the human body. There is no way you cannot change his way. Human beings are perfect. Nobody can change the pH of the body. If you go from 7.4, which is a normal pH, to 7.6, you die. If you go down to 7.1, you die. So people who want to sell products and acid diet, alkaline diet, all that, I don't know how they got it.
Wouldn't you want to keep it perfectly neutral?
Exactly. Just listen to this. Our ancestors, you go in the garden, they ate tomatoes, they ate potatoes, they ate meat, they ate chicken. They didn't separate everything from acid to alkaline. You follow me or no? But I am not 100% accurate what I say about, I shared with you the opinion, but I'm 99.9% accurate that what I'm saying is true.
Okay, the other thing is most of the food that we eat is acidic, right?
Well, it doesn't really matter. You're right, but actually it's acidic or alkaline. Citrus is acid. It's good for us. Spinach is alkaline. It's good for us. In the stomach, pH is 1 to 3. There is no alkaline in the world. It's going to beat the acid of the stomach, right? Look at chemistry, right? pH 1 is equal to the battery acid of your car. There is no alkaline going to beat that. Then go to the bile. pH of 9 equal to lime. So alkaline. Who can beat that? So we are equipped to handle acid and alkaline. And acid and alkaline, I just don't want the public to be fanatics. I want it to simplify their life. I want them when they go to McDonald's and go to the bathroom and they feel like they want to have a cup of coffee, it's okay. If they want to have a salad and sit down, it's okay. You follow me? We don't want robots that the people say, I can go here, I can go here, I can go here. I want you to be normal and know what you're doing. So we enjoy the other part of our life. That's a very good question. Thank you so much. Yes, ma'am.
I have a friend who was recently diagnosed with brain cancerous tumors. is the second time it happens to her. She first got it 10 years ago when it was benign that first time. Now it appears to be cancerous. The only thing, I know that she hasn't been eating the greatest of food, but she has admitted she's definitely addicted to Diet Coke, and she drinks Diet Coke all day, every day.
Can you repeat the question?
Okay, the question, she have a friend who have a brain cancer and she eats bad food.
Diet Coke, is there a correlation with the aspartame in Diet Coke?
Okay, Joyce, you're in the back right here, and I'm going to tell you what she said. She said, is any relation to aspartame to cancer of the brain? And the reason I say Joyce, because we're both involved in that for many years. Absolutely. The aspartame was what behind Gulf War syndrome. Aspartame in a temperature of 80 degrees is stable. Once you bring it to 100 degrees, it breaks down to formaldehyde and methyl alcohol. That causes problems. And that's what happened in the Gulf War, Gulf War #1, when they had the Coke, the Diet Coke sitting in the hot sun, and the soldier drinking it. They were drinking formaldehyde and methyl alcohol. And I gave a lecture here about it, and next day I got a call from Monsanto, if you don't close your mouth, we're going to punish you. By saying that in my lecture. Then I told them, get lost. I did. I told them, I only feel God, I don't feel anybody. Besides, I do have another country to go to called Egypt. If I have a problem, I just run over there and get some protection, you know. So anyway, I think if you believe in something, stand for it, and God will be on your side and you will win. But if you have that fear, they're going to win. And the people who attack nutrition, we have to attack back. And by saying to them, no, we are right, and our patient. I have 25,000 patients I've seen over the years. I have the highest success rate against cancer in any doctor in the country. And the reason was not I'm good at it. The reason I applied nutrition to my work and got rid of chemicals and give gamma globulin, I directed the patient how to get better immune system. That's all I did. And that's why it works. But that's a very good question. You said, yes, it does cause problem. Yes, the answer, she should get rid of it. And brain tumor is easy to cure and easy to take care of. She probably will do well. Okay. Yes, in the back. You don't have to. Stand up. Okay, go ahead.
If you're under treatment for lymphoma and you weigh about 225 pounds, how much would you take of the protein each day? How much vitamin C would a person take? How do you determine that?
If you want to know how much to take of vitamin, you call my office and they mail you the sheet how much each person should be taking. Okay? I don't have time to talk about it now. But it doesn't matter. If you have a lymphoma, which is cancer, you must treat it as cancer, and you need the chemotherapy, and you need the nutrition, and you need the relaxation, anti-stress, and you need the good clean air with air source, you need the clean water with best water, you need to clean your food, you need to behave properly, and then you have to have faith that you're going to make it.
Is there any particular supplement that would help isolate the blood supply with cancer?
Not yet. We are doing that right now, but you know, it's a joke because we all have cancer cells every day. We all have cancer cells every day. The main thing is how you prevent it from coming. Right now in our patients, we do blood tests on every patient now, tumor markers. We also check everybody, if Medicare covers it, which they do, we check them for cancer completely, head to toe, you know, right now with different methods. If they don't, regular insurance sometimes they do cover, but they don't cover tumor markers, of course, they cover everything else. But to try to shut the blood supply in emergency, yes, it's a good idea. They're doing that right now. One more question. Yes?
I've heard that eating sugar is very helpful to cancer growth. Can you comment on that?
Actually, I should have talked about it tonight, which I forgot. The question is, eating sugar can encourage cancer. The answer is yes. The reason behind that, if you remember the lecture we gave right here on Syndrome X, that when you eat sugar, it goes to the liver. The liver is very sensitive to sugar. The liver doesn't know what to do with it. The liver sends most of the sugar to the brain, and the rest of it, the liver converted to fat around the waist and converted to a chemical called salamide, and the salamide makes the DNA mutation that causes cancer. That's the reason the sugar causes cancer. Thank you very much, and you have a good night.